Good evening, ladies and gentlemen, and a very warm welcome to you on today's virtual panel discussion. These myths related to IVF will surprise you. As we gather here on this occasion, let us reflect on the remarkable advancements made in the field of fertility treatments. World IVF Day serves as a powerful reminder of the hope and happiness that millions of families have experienced through this marvel of medical science. On this day, we celebrate the triumphs of science, the dedication of experts, and the resilience of countless couples who have turned their dreams of parenthood into reality. But while IVF has indeed transformed countless lives, it has not been immune to the persistent myths and misunderstandings that often circulate in society. In the run up to World IVF Day, we embark on a quest to demystify these misconceptions, armed with the insights of leading fertility specialists. I'm your host, Sakshi Mandwal, and joining me for today's discussion are fertility specialists. First of all, Dr. Akanksha Loomba of Madhuraj Hospital and IVF Center, Kanpur, and Dr. Vandana Jain, Bardhaman Hospital and IVF Center, Muzaffarnagar. Welcome on the show, doctors. Now, quickly, doctors, from debunking the notion that IVF is a last resort for hopeless cases to unveiling the astounding success rates that IVF clinics have achieved over the years, our journey tonight will be eye opening and enlightening. So, without further ado, let's deep dive straight into the discussion. And my first question today over here is going to be towards Dr. Akanksha Loomba. Now, doctor, there is a common misconception that most people who seek IVF treatments are those who have fertility issues. Is IVF only for couples who have exhausted all other fertility options?
Yeah, Sakshi, thanks to this platform that we can talk about IVF, and definitely IVF is a current topic of interest with the couples these days because it's getting very popular. But as your first question towards the myths and truths regarding IVF, I think it's a very interesting question that IVF treatment is not just for infertile couples. IVF treatment, if you are infertile, definitely IVF is a very good option as a treatment modality, but it is available as a procedural treatment for many other people, like there are single people, like people of same sex relationship who cannot conceive naturally despite being fertile. Then there are other people, we have like single parents also who want to become single parents these days, so they can take a donor egg or a sperm and conceive even if they are like they cannot have a natural pregnancy. So IVF is a good option for them to get a baby of their own. And then we have some couples suffering from some genetic disorders and other problems. They also can conceive through, they can take IVF as a treatment modality because they are not having normal babies and some genetic disorders are going on in the family. So they can opt to IVF, where some donor programs would help them to get a healthy and a healthy baby with them. And then, like we are seeing in lot of these LGBT community people also, they are deprived of this natural conception of pregnancy. So they are also opting at a large numbers into IVF procedures. Then going to like taking the latest lifestyle changes in our generation, like women have become very work oriented, they are career oriented, so they are going towards late marriages. So we can see that lately you have seen so many actresses, they are getting their oocytes frozen so that they can later on in the younger age they get the oocytes freeze, and then they can go for IVF treatment later on when they get married. So basically for people who are very busy professionally, like people in merchant navy and other working women these days, so then sometimes they don't get time to actually plan their pregnancy properly. So the IVF is a nice modality for them to have a baby even if they are not infertile.
Right. And doctor, if I were to just take this point forward that you mentioned that, sometimes because of the time consummation also, individuals or females especially cannot find the time to do that. Now, some individuals, doctor, are hesitant about IVF as they feel that it might be a highly painful treatment method. Is IVF a painful procedure or is this just a myth that is surrounding it?
No, Sakshi, I wouldn't say it's a painful procedure. Yeah, but it is a time consuming sometimes because you have to understand the process first before going into anything. And like I say, any treatment for that sake, even if you're going for a normal vaccination, like cancer, cervical cancer vaccination or any vaccination, it's an injection. So some people are very scared of any form of injections. So these days, lately, the hormonal injections have become so patient friendly that generally patients do not, and our staff is so well trained for the administration of the injections. So it is actually not as painful, but definitely you need to do proper follow-ups, and you need to spare some time from your busy schedule, so to take proper monitoring of your medical entire treatment you are getting from your doctor. So you, more than painful, it is a time consuming method, and you have to like focus and totally concentrate on your treatment that time. You can't just
Right.
take it easy, like yes, I can anytime go for my checkup, and you have to like really follow your doctor and the instructions.
Yes, indeed. I'll come down to you now, Doctor. Dr. Bandana, I'll be coming to you because what just
Yes.
now Dr. Kansha just mentioned that the process of IVF, if one has to take the IVF treatment, then it is not painful, but it is definitely a time consuming process. Now, due to the process of IVF, there are some concerns, Doctor, that children conceived via this method end up dealing with health or developmental issues. So, are IVF conceived children more prone to health issues or developmental delays?
So this is a very common myth, and I do get a lot of patients in my OPD who always ask this: Is doctor, is my child going to be normal? Isn't it that if you do IVF or for that matter ICSI, there are some congenital anomalies associated with it? So I would like to clear upon that the scientific evidence also says that there are no associated anomalies along with IVF and ICSI. The entire media and everything, now we have data available for almost more than 3 decades. So I don't think there is any associated abnormality or any physical or developmental delay, or the milestones also. The children are same as a normal birth. They have to understand that the process is same. It's just happening outside, and everything is medically tested. So there is no associated anomalies.
So that's in fact a lot of good news or a big good news for anybody who's watching us over here today, especially females, because these kind of myths I believe are very important that they should be broken. That kids who are born out of IVF treatment may have some kind of abnormalities or developmental concerns. But as just now you just pointed out, Dr. Vandana, that no such myths are true when it comes to getting the IVF treatment. Now, Dr. Vandana, I'll just take this point further that some say that age also plays a vital role in the success of IVF. Is IVF only
Yes.
effective for younger women, doctor, or does age significantly affect the success rate?
So to answer this question, we must understand the concept. The concept is aging is different for every woman. First of all, a woman might age faster, a woman might age slower. By aging, I mean the ovarian reserve. What matters the most in IVF, if a patient is going for a self cycle, is her ovarian reserve. So suppose a woman is 37, but her ovarian reserve is fine, AMH is fine, her antral follicle count is fine. She does not have any lower chances of IVF compared to a woman who has a similar AMH and ovarian reserve. Whereas sometimes because of lifestyle changes, we do see patients, or genetic reasons or hereditary reasons, we do see patients of premature ovarian failure, or even at the age of 25, 26, 30, we do see that they have a low ovarian reserve, that is a low AMH, or the antral follicle count is low. They stop having periods or have scanty flow or have withdrawal bleeding only. So these are the patients in which, in spite of being younger, the results will decline. Why? Because you have less root size. The less root size, the less results. Whereas in a woman who is 30 plus or 37 or 38, if the AMH is fine, she stands an equal chance as of opposed to a young woman who has a similar AMH. So we must
Right.
understand this concept.
Right. But doctor, I just want to take this point further. You just mentioned about age and specifically in the bracket of 30 plus women. What about women who are looking at possibly targeting the IVF treatment post their 40s? Is that still a possibility for them also?
Yes, why not? We do get a, now, since because of late marriages, the people come to our clinic, and we have an infertility clinic, and the most common age of visiting is 37, 38. And by the time they get worked up or they get mentally convinced for an IVF procedure, they do turn 40. But yes, we should not say that if someone is 40, we should not think in our minds, oh, it's not possible or it's very late. No. If you're fine, you're fit, your ovarian reserve, your tests are
Exactly.
normal, you have no medical, see, other than age factor, some people are fit and they do not have any medical complications, for example diabetes, hypertension, or other or obesity, whereas some at 30 also will have those complications. So if you're 40, age is just a number in this case. If you're 40 but your ovarian reserve is good and you're having your cycles and you have no associated medical disorder, you are good to go for an IVF. You should not consider that.
That's a very important and a very valid point that you just made, Doctor. In fact, in terms of information, also very valid information. I'll now move on back towards Dr. Kansha, and I'll ask you that birth defects have also been a cause of concern with IVF. Sometimes these questions do come up. That does IVF increase the likelihood of birth defects in babies when they are born at that time?
Sakshi, this is actually a very, very common question which we face from our patients regularly, because they feel that it is something which is not natural, and IVF babies are created in the lab. So they feel that there's something which is different from the natural conception. So they might be increased risk. But actually, it's a very difficult question to answer in such short time. But my answer will be no. So basically, I must say that I'm proudly, like, it's been 24 years to our IVF center now. And luckily, I think very, very less incidence of any birth defects we have seen in our IVF babies. And they've all been very, very healthy, very agile, very, I should say, the patients come and tell us, "Ki, ma'am, your babies are so intelligent, they're doing so well in the school and in life. Our first test tube baby is already married, and now she's studying in university. She got married early because she was a villager. She got married at the age of 18, but both husband and wife are studying and they are very intelligent. So basically, when we have to, actually the problem is that we have to learn to discriminate, that there's a huge difference between the general population and the infertile population. The IVF babies are made from the infertile couples. So we should not be comparing the general population with them, because generally, like 3 to 5% of the population
Yes, Doctor.
suffer from some sort of birth defects. So there are some reports that maybe IVF or ICSI procedures are increasing the chances of birth defect. But in general, I would say that it probably might increase the risk by 1%. And when we say that, we have to bear in mind that infertile couples are those who are invariably slightly older in age, and the couples are having some sort of history. Like they might be having some abnormal sperm counts, a male problem, or the female might be suffering from unhealthy eggs, endometriosis, tuberculosis, or some other disorder like PCOS. So they are generally not as healthy and normal as our general population. So when these couples conceive with the help of IVF, we can say that the chances of birth defects compared to the normal healthy population might be 1% more. So, but there's a lot of investigation going on at the moment, and there's a lot of experience gained from all those years of IVF, that we should bear in mind that IVF, especially pregnancies and IVF fetuses, are heavily screened. And during pregnancy, sometimes before even conception, these babies are screened by pre-genetic testings and all. So we have to eliminate the risk of birth defects as much as possible.
Right.
So
So basically, you just now
a lot
mentioned,
of
Dr.
work is going on still on this.
Right. And you also mentioned a very important point over here that IVF treatment is primarily or most importantly kept for couples who have some kind of health issues or could be
Yeah,
also are facing infertility concerns. So for the regular population, IVF is not the go-to option, most or the most preferred option, if I could phrase it that ways.
yeah,
So I'll
yeah,
move on
exactly.
now and then take the next question also up over here, which is that there are people, doctor, who believe that lifestyle factors can influence IVF treatment results also, just what I was talking about right now. Can
Yes, yes.
lifestyle factors such as like stress or diet or significantly impact the success of, IVF treatments? And more importantly, what
Definitely,
like eating,
definitely. I
lifestyle?
personally, yeah, personally, I believe that anything which we do, science cannot overrule your natural uh, nature. It cannot overrule nature. And there are some things that you have to follow, even if we have come to the robotic age these days, but still we have to follow that there are few things, environmental changes, stress factors, emotional problems. These all definitely have a great, they take a great toll on the hormonal essay of the female. And then if there's bad, poor eating habits, and smoking, drinking, stress, late nights, all these late night working hours, so all these things has a toll on the couple, even the women and the men, both of them, due to environmental stress or emotional stress. The fertility index does get affected. And we see that whenever we counsel our patients for IVF, I personally make it a point to first start counseling them about healthy diet and healthy lifestyle. And especially, I've seen an Indian scenario that couples, infertile couples, they are very, very anxious. They're anxious because of social pressures, family pressures. The bacha nahi ho raha hai. We are somebody in their family has conceived earlier. They are younger couples and they have conceived earlier, and they are getting that stress also. And when this stress factor takes a toll, I have personally seen that when I'm stimulating a lady, and suddenly I see that she has a good ovarian reserve, but the eggs are not proliferating well. They are not, the growth of the follicles is not happening well. And when I counsel my patient and tell them to take less of stress, I have seen personally that suddenly they give a better result. So stress has a major factor in affecting the response of a patient towards any in IVF treatment.
Right. So, but basically, if I could just sum up what you just said, is that having a healthy lifestyle at the end of the day
Yeah.
is going to be the cure for a million different problems for anybody in life, not just if it comes to resorting to IVF treatment, but more importantly, overall, also, if we maintain a good, healthy lifestyle, then we
Exactly.
can help our own body, our own mind, and also our
Yes.
own health from different kinds of, problems that we face in our
Yeah.
everyday life.
Yeah,
Now,
like the
Dr.
pH of the body, we always counsel the patient that don't take very spicy food. The pH of the body should be basic. So there are many aspects to it which healthy eating and healthy lifestyle definitely would help them to conceive earlier.
Yes, I'm sure what you just said is bang on the point. I'll just take this point further and I'll ask Dr. Vandana now that another point of concern for people is the cost of IVF treatments, doctor. With some couples just worried about shelling out their entire savings for IVF treatments. So, is IVF too expensive and financially out of reach for most of the couples? Or would you say that the treatment, that is the IVF treatment, is an affordable one for common man also?
See, the question you asked is a very good question. In fact, it is a most common myth I've seen. They don't go to IVF because they don't even want to find out about the cost, because they already have it in their minds that it is supposed to be expensive and we cannot afford it. But what they are going through, they are coming, they are visiting the clinic almost 6 times a month, paying for the taxi, paying for coming there, leaving their work, and paying for injections and going through IUI, which they suppose is cheaper, or through natural treatments. That is again going to sum up equal to that. So we need to, if a patient has a significant male factor, for example, I'm just giving you one example. If she has a significant male factor, but she is just shying away from IVF because she thinks that it is too expensive, what we do is we give her a counseling, IVF counseling. And in IVF counseling, we offer her various packages. So in packages, though there is not much of a difference, but the cost of injections can be made different, definitely, because there is no female factor. We can use cheaper injections. We don't need to go for the highly purified ones. That can make a significant difference to the cost of the IVF cycle. And instead of going for IUI or repeated IUI, she should go for IVF. She should be explained it like this, that see, the cost you are taking up in multiple IUI treatment is going to sum up as same, right? And then for other couples, the low cost IVF cycles are also available. Natural cycle IVFs are also available. So all depends on upon your counseling, how you counsel the patient, and how you have to look differently at the costs.
Right. So that is going to be a very important consideration. So all the people over here who are joining us in the stream right now, as Dr. Vandana just mentioned, that when you think about the financial angle of IVF treatments, what is more important is that for any queries or concerns that you have, you can also be given counseling, and that should be a big help in helping you ease out as to what kind of treatment, what is the process going to be, and how much is it going to sit for you on your pocket. All of that, there are doctors and counselors who can guide you through the process of it. Now, doctor, some people also believe that IVF can hamper a woman's natural fertility
Yeah.
and have a negative effect on future pregnancies. Does IVF
So
have a negative impact on a woman's natural fertility for future pregnancies, doctor?
very common question. So yeah, so a lot of times patients are going for IVF because of unexplained infertility, or they are traveling, or the husband is living separately, whatever reasons. So they think that if they go through one IVF, the second child will be have to through IVF. Whereas it is the opposite. Whenever I've seen that if you're down regulating a patient, or patient is going for a long cycle, it does a lot of good to the patient. So suppose a lot of times I've seen this also, that if a cycle fails, suppose in some patients, and it was an unexplained, and patient doesn't want to go for IVF immediately, so they try one or two cycles naturally. We have seen that they conceive immediately. So maybe we
Yeah,
can cite these
I totally,
examples to those.
yes, yes,
We
I
can
totally
see
agree with
examples.
Manu.
Yes,
Yes.
Dr.
And
Kansha.
second thing, and we have to counsel them that the see what is IVF. We have to tell them that what we are doing is just suppressing your hormones, which is not causing you any good. Or if you're going for a long cycle, or if you're going for a 9 type cycle, we're just giving you injections which are required for your body to simulate those eggs, which are natural products, which your body would naturally anyways produce. It's just in a little excess. So maybe that will not, maybe it is a little harmful for you in the in the way that it will produce extra eggs, but it is otherwise not going to make any difference to your body, and will cause you only good in the future.
Yeah,
Yes, of course.
I
Yes, Dr. Kansha. Yes, please tell me.
Yeah, yeah, Sakshi. This was a very, very good question, and Vanna has explained it very well. So I just wanted to add few points. Like personally, I've seen with my patients in PCOD, we when we stimulate, because PCOD is a problem where they have surplus number of eggs, but they are not growing and they're not ovulating. So these are, and there are grades of PCOS like mild, moderate, severe. So the moderate to severe grade of PCODs, they do very well in IVF. And even after IVF treatment, like I think few of my patients have conceived that way, is that we just took out the eggs, we froze the embryos, and we were planning for the transfer, and in between the patient conceived naturally. So this is the magic of IVF. Then the patient comes with the egg naturally. So it is because we gave such a high stimulation and boost to the ovary that the natural growth of the follicles became good. So IVF is not, because we are trained doctors. See, IVF, first, one very important point I also want to put forth is that I nobody just any Tom, Dick, and Harry should not come open an IVF clinic and sit as an IVF specialist. You should get a proper training, because properly stimulating the ovary and preparing a patient for IVF is an art. Doing IVF is an art. Choosing the right type of patients for IVF procedure is an art. And when you do that, you are not going to harm the patient. Anyways, the couple will be benefited by that.
Right. So at the end of the day, there are so many myths that seem to be surrounded around IVF treatment. But I do hope sincerely for all our viewers who have joined us in the stream in the special session of IVF treatments and debunking the myths that are associated around IVF, that you have got enough information today that debunks those myths that you might have in your brain when it comes to IVF treatment. On that note, first of all, I would like to thank Dr. Vandana and Dr. Kancha for taking out your time. Thank you so much, doctors, for
Thank you
joining
so
us and
much.
sharing your
Thank you,
Thank
valuable
you.
Sakshi.
Thank.
insights. Well, guys, we have yet another doctor who has joined us in this session to talk about the IVF treatment and how to debunk the myths associated with IVF treatment. I am joined over here by Dr. Shipra Bagchi from IVF Bagchi Center, Lucknow. Good evening, doctor, and thank you so much for coming on board with us. Now, doctor, I just wish to take this conversation forward because we already had Dr. Kansha and Dr. Vandana with us, who did give us some very valuable insights into IVF treatment and what are the kind of myths associated. But a couple of other myths that still remain unanswered. One of them would be that sometimes people think that if one undergoes IVF treatment, then women become more susceptible towards developing cancer. Now, Is that a myth, or is there some kind of association between women becoming more prone towards developing cancer through the IVF treatment?
Yes, this is a very common question that even comes sometimes in the minds of the fertility specialist also, that whether the IVF treatment can increase the risk of cancer in the woman who is receiving it. But I must tell you that many studies have shown that there is no increased risk of cancer even after taking multiple cycles of IVF. Many studies have been done worldwide and no study has shown any increase in the risk of cancer. But if someone is being treated for any genital cancer, ovarian cancer or breast cancer, they should be cautious. They should discuss their condition with their fertility specialist and then opt for the IVF treatment according to their circumstances, their treatment status and the stage of the treatment. Otherwise, there is no increased risk of cancer after taking IVF treatment.
Thank you so much, doctor, for giving us that valuable bit of information, because I also believe that it's very important to debunk such myths that come into the common man's mind. Often, when we look at the various advancements that technology has made, especially today, because we are talking about the IVF treatment. And the other kind of myth that seems to be associated around the IVF treatment is that, is IVF treatment meant for obese people, or can obese people take such treatment, or is it only meant for slim and trim and much more healthier people and not the obese people?
Obesity is as such not a contraindication for IVF treatment, but yes, if a person is having a high BMI, more than 30-35, they will have a lesser chance of IVF success, because sometimes the obesity is associated with the other hormonal disturbances. It may affect the treatment and its result. So, if somebody is having high BMI and is planning for IVF, they should first try to reduce their weight, because after getting pregnant also, the obesity may lead to certain complications like hypertension, diabetes and other complications, premature labor and all. So, before taking IVF treatment, always try to reduce your weight, and if it is not possible, then you can take the treatment. There is no contraindication.
Thank you once again, Doctor, for giving us your valuable insight over here on such myths. It's been a pleasure having you on board. And in fact, to all the other doctors also, Dr. Akanksha, Dr. Vandana, and Dr. Bagchi, thank you so much for joining us over here today. It's been a pleasure, and also it's been very insightful hearing your valuable insights on such an important topic, which is the IVF treatment. And thank you for debunking the myths, especially for those common people who would possibly be thinking of taking the route of IVF treatment. I hope that a lot of your myths today stand to get demystified. On that note, once again, thank you so much, doctors. This was your host, ladies and gentlemen, boys and girls, Sakshi Mandwal, who was conducting this session. For now, it's me going to be saying goodbye to all of you. We'll see you again in some other session soon. Till then, stay well and take care.